supporting survivors when we now have been cut, it is cutting salaries, every single thing that could happen has happened, and we're supposed to just carry on as though there hasn't been an impact, when there 110% has been an impact for all of the survivors that we're serving, but also for the people who are trying to care for these survivors and provide these services.
Thank you. So why is VOCA so important for the sustainability of our programs and of the work that we do? And is it okay every time that they say, you have to find other funding? You cannot just rely on VOCA. Why is VOCA so important for the sustainabilities of our programs?
I'll talk a little bit about that, if that's okay. So, so I'm representing the Southeast Ohio region, which is disproportionately rural communities. And also most of them are Appalachian communities. And the history of Appalachia is one of extraction. There's, big financial interests that aren't from this area, and they come in and they take what's been the coal or the timber or other natural resources and don't necessarily invest in that community. It's this idea of the capital is really just going out, into other communities. And that's something that we continue to see in our region is a lack of other real sources of funding because of the divestment in these communities. So we have a total of 2 very small kind of community foundations that are available to us, only a handful of corporate foundations. And that makes it really difficult when our only other revenue stream is donations by individuals. But when you're serving 8 of, the counties that historically rank in the top 20 of the poorest counties, that's not particularly a reliable funding stream either. So we in Southeast Ohio rely on the federal funding because of the dynamics of our communities and the lack of other kind of viable, sustainable sources of funding, right? Because we're always super grateful for the $5,000 we get from this foundation, but doesn't make a huge dent when you're covering, providing 24/7 services to 8 counties. Mm-hmm. So that's why it's so absolutely essential to the work that we do here in Southeast Ohio, is because, where it's like, go find other funding, we all kind of look around and we're like, where, right? I mean, it's not here.
Thank you, Jennifer. Molly, why is VOCA so important for your program and your areas?
Sorry, I was frozen. So with VOCA, the benefit of this funding was that it could be reapplied for year after year just to sustain programs. In Northeast Ohio, we have such a variety of communities. We go from the very large Cleveland, Cuyahoga County, down to our Tuscarawas and Carroll County, more rural communities. And so you have some areas that are very rich in foundations, which is wonderful. But foundations also get a lot of requests, and they can't fulfill everything. And when they do fulfill requests, a lot of times it's for the purchase of something, something that's needed. It's not necessarily to sustain programming. And that was the benefit of VOCA. It was year after year, it was to sustain programming. It was to sustain our crisis lines, our hospital advocacy programs, counseling programs. And these were just vital programs that all rape crisis centers need. And when that funding gets drastically cut, it's very hard to find sustainable funding that can keep programs running versus the purchase of items.
Thank you, Molly. Lori, what does VOCA mean for sustainability of your programs?
I'm, certainly agreeing with both Jen and Molly. And I think that from a salary standpoint, I mean, a lot of our salaries are coming from the VOCA grant. And when you, to their point, when you try to go to a foundation or somewhere like that, they're not giving you operational costs typically. Depending on what your cut is, there's no way to make that up in a foundation. And from the central region, we have the same thing as Molly. We've got Columbus, some of the richer counties, Delaware County, big programs, but we've also seen major cuts in this area. So I feel like for us, for our agency personally, this is huge in terms of our day-to-day operations and salaries. And so I think that, as we kind of talked earlier, all the extras that we were able to cover from VOCA, I mean, those are the first things off the table. Those aren't going to cover anything anymore. There's no marketing. There's no any of the, travel. None of that is going to be used from VOCA funding anymore. So it was nice to have that. And now we're not going to have that, and we have to figure out another way.
Thank you. Kristin.
And also, I agree with everything my colleagues are saying here. We also see that in the Southwestern, region, we are in a massive economic recession. We are all engaging and trying to show up for gender-based violence, which is a public health epidemic, at the same time that we have a global health pandemic. At the same time, all of us are trying to show up for survivors we serve who are also experiencing structural racism, which is also a public health epidemic. So we're in the epicenter of 3 public health epidemics at a time when VOCA is really being decimated. And it's not only like, what's the impact of that? I view this absolutely as injustice because of why the Victims' Crime Fund exists in the first place. It is concretized by law from the 1984 Victims of Crime Act. By that, funds are to go to victims of crime. That's a beautiful form of justice there. Specifically, then further flushed out in making sure, mandated by law, that goes to child abuse, victim service agencies, rape crisis centers, and domestic violence agencies. So to have something that is concretized by law, it's a bipartisan issue where legislative leaders have stood behind this for decades. And to now have the trickle down effect where the revenue and the settlement fees and, with the conviction rates, it has not gone into that federal bucket, and some of that money coming out of that federal bucket that is not focused on child abuse serving agencies, rape crisis centers, or domestic violence agencies. And then for all of that to happen during this perfect storm, that to me is supreme injustice. And we can plan all we need to try to plan for. At the end of the day, critical masses of funding are stripped away. That means front lines will be stripped away. That means survivors will not be served. And by the way, it's already a public health epidemic. We couldn't serve enough anyhow before this. We serve about 8,600 survivors at the agency I represent in the Southwest region in a given year. That's maybe 5% of the total survivors out there. And so now to have the funding stripped now. And so when you talk about sustainability, it's not just sustainability of our agency or our regions. This is sustainability of our community. This is bottom line about people, families, children, mothers, survivors in our community.
Thank you. And sometimes people don't understand those dynamics, right? About we are here to service the community. We are in the center of the community, right? And as you clearly mentioned in reference to all of the layers of being in an institutionalized oppression system and in a systematic oppressive system that in the midst of several pandemics, now we're also being stripped of funds. And where are not organizations, but humans going to go to receive the support that we go? When we look at the percentage in the cuts, we are going back to services of close to 20 years ago, unfortunately. So, and we all know that sexual violence, gender-based violence are the most underreported crimes in the United States, and we know those dynamics. And there's this misconception that even within the midst of COVID and the civil unrest, that rape was not occurring. And that's not true. It actually continued to happen. It's still happening. The model of stay at home was not safe for everybody. That is not safe for everybody. So we had to find fundings to go ahead and move people when schools were closed, when students are not able to have their case managers or social workers or visits or the well care visits, and adults being in tune with what's going on. They had no way of expressing that maybe where they were at, there is perpetration of violence, right? And that they are being victimized. So their time of respite was normally when they had the extracurricular activities, or they were at school, or the essential workers were out working and not necessarily staying at home, right? So there are different layers to understanding these dynamics of what it actually means, especially when we say that we serve all, the marginalized, the underserved, the underrepresented, that we serve our community. And we are unable to do so when there is so much cut within our programs. And to put it in perspective, because I think that some of the people don't have access to necessarily knowing what the cuts mean in percentage or amounts or where we're at. So from a coalition perspective, and Ohio is very unique, as we've always mentioned, that we have different coalition that have federal designation based on what they're concentrating on, right? So the coalitions in Ohio have specific responsibilities, missions, agencies, but here, our coalitions in Ohio are not dual, right? So each one of us works in an individual, not in a vacuum, but we all stick to our line. We work in collaboration. A lot of our centers are dual agencies or multi-level agencies. But we have representation from domestic violence, from sexual violence, from human trafficking coalition, from victims of crime in itself, which is everything else but VOCA, harassment, and all of that. But we have 33 programs that are considered rape crisis centers within the state of Ohio, right? And each one of you represents a particular region, and the Northwest region has 6 programs. Northeast region has 12 programs. Central region has 4 rape crisis program. Southwest region has 7 programs, and Southeast region has 5 programs. And it equates to a $10.5 million on rape crisis funding cuts. And there were 3 programs within all of our regions that did not receive any VOCA funding at all. So Kristin, you say that you serve 8,500. Lori, you're at about the 5,000. And Dual Molly, the same with your regions. Jen, with your 8 territories. So there's 88 counties, 33 rape crisis centers, 77 counties being served with the 33 rape crisis centers. And actually, if we look at the 3 programs, and 75 75 domestic violence designation programs, right? Which some are dual. And if we look at those that didn't receive the funding enough to be operational or continue, that there's nothing else. When we were at only 11 regions, 11 counties not being served, we could actually go ahead and say that we're probably at 20 counties back again in this century, right? This century, 2020, that don't have a domestic violence, rape crisis center, that won't have the services, right? That they actually need because of these cuts, even though we were prepared. And once again, it wasn't that the state did not utilize the funds appropriately. It's not that it's not distributed accordingly. It's just that from $111 million at a federal level, Ohio received 55 million. There was no way for 360 some organizations that work with victims of crime to receive the amount that they normally do. So we have found each other scrambling, right? How did your agencies have to cut any positions? Or in your forecasting, did you already reorganize, reshaped? Are you still considering that there might be some cuts coming along the way? Or have you heard from the directors and programs that you represent in your regions that they did have to make some substantial cuts to either positions, programming, or service?
So Rosa, here at Compass, we did end up cutting our case management services. And we also have elected not to fill an open position that we have. Unfortunately, it's one of our positions that are working on campuses, right? So, it's sad. It's sad because we're not going to have the same capacity to do campus level work as before, but decisions had to be made, and we want to try to be as fiscally sustainable as we can. I've talked to a number of the rape crisis centers in Northeast Ohio, and it's very disheartening to hear what they're having to do. There's still a lot of conversations being had about how best to remain open and remain operational on the level of funding that they received. And so how do you try to sustain the programming and the services as much as possible? And I think that's what many of my colleagues in Northeast Ohio are having that discussion right now. But definitely many of them are absolutely experiencing cuts in staffing, which therefore means there's cuts in services, because you can't provide the service if you don't have the staff to do that. We did have one rape crisis center in our region that received no funding. And so we're working with them to try to figure out how do we move forward with that? How do we try to still keep those services in some capacity? And so there's still just a lot of discussions around what it's going to look like in Northeast Ohio moving forward.
Thank you, Molly. Kristin?
Yeah, so we're still strategizing within our agency. So what we knew, in order to keep up with critical mass of what we're seeing, I'm sure like many of my colleagues, for 7 months solid during COVID, we've had a 25% surge of new survivors. Our hotline has consistently spiked 53%. So that was before VOCA cuts. So we knew we needed more humans to respond. We needed more advocates. So we've been in a hiring freeze all year. We're like many of my colleagues in agencies across the state, we respond 24/7. So we're using our daytime staff to now work extra hours to respond in the evenings because we have this ongoing surge. So of course, staff end up getting exhausted, and we lose staff by staff resigning. So this is before cuts. Then with the cuts, we absolutely cannot fill positions. We cannot add positions. We know when our agency alone got $320,000 cut. You don't manage that without cutting services, and who's behind generating those services. Therapy immediately will be cut. Therapy is critical in holding the space and perhaps trying to get towards understanding trauma and dealing with trauma. And even the dream of, how does healing from trauma of sexual assault look? So when you're looking at not filling current positions of advocates, not bringing on more advocates, we're at a net loss of about 8 advocates, give or take, of what we truly need to respond to the need. So yeah, we're going into executive strategy session to roll back the clock of looking at, if we just got pushed back 20 years with the funding and the support on top of the tidal wave of a pandemic that is out of control and is, by the CDC counts and head task force counts at the White House, saying we should prepare in this country for 400,000 loss by the end of the year. All of that has implications on survivors, policy, funding, philanthropy, and the recession. So I don't want to say right now too much on record what we have to cut out of respect for folks on what we're dealing with in our region.
Thank you, Kristin. Lori.
Like everyone else, we're still strategizing, trying to decide. A couple of things that have come to light for us specifically in our agency, our shelter numbers actually doubled last year. So when we wrote for the VOCA grant, it was to also include an evening advocate, because you can't have the same number of advocates serving twice as many people in your shelter. Seems very logical. And then when you take a cut that's $80,000, it also is impossible to say, I think we don't need that evening advocate anymore, because that's still not serving people. And if you double numbers, you need someone else to be in shelter. So I feel like, it's just like, I feel like I'm living in this oxymoron, like none of it goes together. So one of the things we did just kind of immediately is said, okay, we're gonna have to make that a 25-hour-a-week position, and we're gonna figure out how to cover the weekends in shelter, which as a dual agency, it does make it a little bit different how we use our VOCA funds, but it also means our on-call people are gonna be monitoring a shelter through a video camera. That is not the best way to serve survivors. So I feel like we've just had to really rethink everything that we're doing. And I also, from a regional standpoint, I've talked to a few of the directors, and it's the same thing. Been in hiring freezes, but now we're not going to be able to hire this position. We're also not going to be able to do, X, Y, and Z programs. So, there's no way you can take the percentage of cuts that we've all taken and not have to really make major decisions. One of my board members in our executive committee last week said she felt like she was in the diary room of Big Brother. Like, it was like you're having these conversations that no one can know about, and you have to be like, as the directors and board of directors, you have to be, very sensitive to all of the things that are going to impact. Now we're impacting people's lives, not only as the survivors, but our employees. And so we're looking at them every day and saying, keep doing what you're doing, keep doing this work. Oh, and by the way, we're going to have to cut you this many hours on your, for your weekly salary potentially. So, those are, just to live in that we're already living in a heavy enough space. And then to have to put that on top of it, it's just been a lot. And so I appreciate being able to have this kind of conversation, and also just the kind of brainstorming that we're all doing to make it feel a little bit more manageable.
Thank you, Lori. Jen.
Yeah, so, like everyone else, we're still working through the final details, but one thing that is most likely going to be a reality for us is taking what were full-time positions and transitioning those into contract positions. And the thing that's unfortunate about that is, large swaths of our communities have no cell phone service, let alone broadband access.
Yes.
Okay, so our work has to be a lot of on the ground, like actually going places, doing outreach. And that's why having a full-time person that can not only respond to survivors when we get a call, but can do that kind of higher level work of connecting with community partners and SART teams and, doing a lot of this, what we call systems advocacy, that provides this what we coordinated community response to violence. And when we transition to utilizing contract workers, I mean, the reality is I have faith in our ability to hire and maintain contract positions, but it's just less formalized. So the quality of services, you just can't build up the expertise in the same way you can with these informal positions. And we're going to lose a lot of that higher level advocacy that is for our area absolutely critical, because social media campaigns and even hanging posters or something that seems pretty basic in terms of outreach. Where do you hang a poster when you're covering 3,500 square miles? The logistics of it is very complicated, and that's why having full-time dedicated folks on the ground in our communities is so important. But we saw $100,000 cut, and we just simply aren't going to be able to maintain those full-time positions and are transitioning to more informalized labor, which isn't trauma-informed either. When you're talking about this work is incredibly difficult, and having full-time folks that are benefits eligible, that can get health insurance, all of these things are absolutely critical to laying the foundation for our staff to be successful for our survivors. And when we have these huge cuts, it's next to impossible to maintain that sort of system of ensuring that, they always say, if you're in a plane crash, you put your oxygen mask on before you put on someone else's. And I feel like for us, that's the biggest thing, is our kind of ability to put on our own oxygen mask and make our staff and people healthy. Then, as Kristin so aptly pointed out, that impacts our survivors. It just has to.
Definitely. And what some of the people tend to miss also is that those that are doing this work, 92.5% are survivors themselves. So when we're talking about this work with our external, right, survivors, we forget that our primary work is in-house, right? That most of the people that we work with are survivors themselves, right? And then they're also being impacted by the cuts, by the sustainability of their funding, their livelihood, the trauma, the layer of trauma and triggering that even doing this work continues to perpetrate and not having the services that is there. I've heard from the Vines, right? Oh, but telehealth and teleadvocacy and telecounseling is great. And it could be. We've had to re-envision what doing all of this in the midst of a crisis is. But is that true in every area? And I see a lot of head nods. Tell me a little bit more. Why does not teleadvocacy, telehealth, telecounseling work for every area, every program, every survivor?
I have
I
one
mean, the obvious. Kristin, you go ahead.
No, I was just going to say I have like one really specific concern. So, Rosa, you indicated before, when our state went to shelter in place, and before that happened, the lever that got pulled, a lot of our hospitals got really compromised in who they let in, right? And it had to from a public health standpoint. So advocates early on were taken out of the response 24/7 to show up and support survivors of sexual assault at the hospitals. So a lot of us throughout the state were trying to figure out, well, as you said before, sexual assault is still occurring, and it even intensifies and increases in many ways because there's the systems of support are really compromised. Things are really behind closed doors now, right? And lack of access at incredible ways. So when we look at like, well, how do we pivot? So a lot of us did try, right? Communicating with the hospitals when someone does present throughout this whole pandemic, can we do this virtually? And you work with what you have, but being a sexual assault survivor, showing up to the hospital, having to go through a forensic exam, knowing I'm going to be there 4 to 6 hours, and not to have someone else there in the form of an advocate to show up and support me. But maybe I have an iPad I can look into? No. Maybe there's a phone I can talk. No. So that was like at the height of shelter in place. And we knew it wasn't what we want, but it's what we had to do. Now we have access to hospitals. Now we're looking at, because of this funding cut, can we show up to 23 hospitals, just our agency alone, in 4 counties, 24/7, 365 days a year, knowing that each point of service delivery can take up to 4 to 6 hours. So now our staff, we have to make decisions based on formulas. With amounts of hours, our staff can be out in the field, because then it's going to take them away from court. It's going to take them from on call. It's going to take them away from the hotline. How long can we break the backs of staff saying, I'm going to keep showing up? But like, the math doesn't add up. And the people who lose most in this mathematical formula that does not add up are survivors. So that is where, yes, we can do all we can to mitigate. Yes, we're going to continue to collaborate. But in real talk, after violence happens when it never should have happened before, gender-based violence, sexual violence right now is winning. Because the insidious nature is of that violence going to isolate you, going to disempower you, and it's winning. And VOCA is, the cuts of VOCA is adding to the wrong side of history with this.
Thank you. And I believe Jen and then Molly had a comment in reference to that.
Yeah, I mean, I just, you know, in the transition to virtual services, all the things Kristin said for sure, you know, when you're with someone on what is more likely than not the worst day of their life, you know, it seems almost offensive, you know, to propose that, you know, this video screen or phone call could be sufficient in really being with that person and sitting with them. But for us, you know, it's the logistics. You know, like I talked about, large swaths, I'm not kidding when I say huge areas have no cell service. I mean, you can't even make a cellular phone call from these areas. And this just isn't our community partners and our survivors. Several of our staff don't even have broadband at home. So when we started talking about, you know, what are the things, the assumptions that we make when we say, let's go virtual, right? The assumptions are devices, are connectivity, are the technical expertise to be able to coordinate that. And one of our choices that we made when we decided not to go virtual was because one of the big things we bring to the table when we're there in, say, the hospital with the SANE nurse is that they're able to focus on the kit, right? That is a very high stress situation where they can literally compromise this person's whole case if they aren't being very careful and precise and labeling things just right. And we felt that almost bordered on unethical for us to add an extra layer onto that nurse to say, hey, and oh, can you move the screen a little to the left so that we can see this person? And it wasn't right to assume that our survivor would have that expertise, or frankly, would have the capacity in that moment, that's the worst day of their life, to make sure that they're accommodating us, to make sure that we can see or we can hear or we can provide that education. So there's so much that underpins that whole idea of, just, go virtual, that if any of those pieces are missing for anybody, right, any of the stakeholder in any of these interactions, then it's not good program development, and it's not a useful avenue for us to explore. And that's one thing that we had to realize pretty early. And what that meant is we weren't getting called. I mean, there were not survivors. Survivors were, when they did choose to go to the hospital, for example, they weren't calling our number, and that's, I mean, like Kristin said, I mean, the violence won, the isolation, the disempowerment.
Yes. Yeah, I had calls here that they would tell me, just by hearing, right, the fear of don't come to the hospital, or the sense of priority. They would tell me, I don't feel that I should go. I don't need to go. I prefer to have a STD than to go ahead and be returned, rejected, not served at the hospital, because everything is COVID, right? Or there's no interaction. Nobody could go with me. Nobody could be there with me. Those were the calls that, as an agency, I was receiving from survivors. And it wasn't that sexual violence was not occurring. It was the fact that, unfortunately, the fear, right, and the isolation and all of the barriers that were put up front made it impossible for some survivors in their trauma to go ahead and access any type of service. And we already know that only 23% of people actually go to the hospital anyway, and less even report. Molly, you had a comment in reference to that?
I was just, when I was sitting here, through this whole conversation that we've had, we have been talking about how difficult it is right now for us to decide what's going to be cut, how we're going to make up the deficit. I mean, we're kind of in crisis mode right now. But what's really terrifying for me is when we start thinking about what it's going to look like a few months out, when all of these cuts that we're having to make have had time to play out, when our systems advocacy and our community collaborations start to break down and survivors are not embraced with a community-wide response. That is, to me, is when this is really going to kind of hit home, and we really see the devastation from these VOCA cuts. It's bad for us right now, but unfortunately, I think it's going to really come to light and really be bad a few months down the road when all of this starts playing out for survivors.
Thank you, Molly. Lori, anything you wanted to add to that?
I was just going to add, and it kind of goes to Molly's point. One of the things, specifically in a story that we've had happen since we've been allowed to be back in the hospital, when our advocates are in there, they are there with survivors. I think that one thing that isn't really ever talked about or considered is what our advocates are doing to keep calm in the entire space. So almost like providing advocacy for the same. Because if the level of what the situation specifically was in this one, I mean, the SANE nurse was like struggling herself. So our advocate is creating kind of this calm environment, or as best as she could, to support the survivor and keep the nurse from losing it. Same thing with the police officer. I mean, he's like never seen this before, didn't know really kind of how to handle it. So our advocates being in the hospital, it's, while the survivor is always the number one, I think one thing that we kind of don't consider is what they're doing for the overall impact of everyone in that. And because they're trauma informed and because of all of the training that they've had, they are able to create a little bit more of a calm environment. And you take, for example, that's another thing that we're cutting. We have to cut training. So, you know, there's so much. I mean, it's like the trickle down effect just continues on and on. And to Molly's point, if we get to that, and as Kristin was saying, you know, it becomes a formula. If we don't have enough hours in the day for people to make those hospital calls, what does that do? What does that do when there isn't someone there to create a calm environment and to help the police officer understand and to help the sane understand? You know, there's so, it's the layers just continue on and on. It's just so much deeper than one thing, check the box and it's done. It really is so much more than that.
Yeah, it's a multidisciplinary approach, right? And advocates and community-based agencies and advocates continue to be the glue in the midst of that chaos and everything that is going on for survivors, for all involved, and even with the cuts, right? And we're talking about the services. Ohio as a whole, from the beginning, never had enough sane nurses with the amount of hospitals that we had. We did not have or still have enough law enforcement understanding the dynamics. We actually were on a surge of kids, right, that were still not processed. And it will probably continue to be in those aspects again, and that we're not trained appropriately, that we're not collected, and that there's not enough. So it is a chain reaction in the way that it actually does affect, at the end of the day, survivors or victims, whichever way they want to call or approach themselves in that format. As we're closing out this conversation and critical conversation, and once again, thank you so much for taking up your time, for being with us today. We will continue these conversations on a weekly basis. We're going to go ahead and have every week a specific region will be highlighted, and you'll have the opportunity of bringing on a community partner or another local rape crisis center or multiple agencies, so that we continue to have these conversations. And on Friday, I do want to invite those that are seeing us today, that we will have the domestic violence representation, we will have Marcy's Law, OVWA, we will have child advocacy centers representing from a coalition perspective the impacts of these cuts at the macro level, right? And what it actually means. So we hope that people can tune in. But if you had an opportunity, closing words or action, what would you like your legislators, your constituents, your members, your community to know about the impact and the needs that we actually have now more than ever for their contribution, for them embracing their voices? What would you like them to know?
For me, the quick bottom line is, you know, as we deal with all of this, I think it's really obvious. All this is very complex and consequential, and sexual violence, as well as all forms of gender-based violence, unfortunately, are just very common. And so as we kind of try to navigate what is common, complex, and consequential, we absolutely must see at the statewide level a survivor agenda. And that agenda gets enacted through policy, through pooling of levers, creative pooling of levers. What does funding look like in the state line budget? Is it enough? And ask those questions. I think it's clear with the data, and go by the data. It's not enough. So what other levers can get pulled to increase that by placing survivors at the state focused agenda?
Thank you. Lori, Molly, Jen.
I would just say, for me, along with what Kristin's saying, visit us, educate yourself, come be where we are, watch what we're doing, talk to the advocates who are working with survivors. I feel like in an effort to learn the complexity, because it is so much, the more that you want to interact with our agencies, there's not any agency in the state that would not welcome someone to come and talk with us, you know, in a smaller group setting, in person with masks, but we will do it. And I feel like that's an important piece of this.
Thank you.
Lori, you said it perfectly what I was thinking. Just talk to us. There's so much that we can tell you. We can tell you what our needs are. We can tell you how you can help us. Just come and talk to us. Learn about us. Learn why this affects everyone in the community. It's not just those of us that work here or our survivors. It's a community-wide issue. So come and talk to us, and we would love to educate you and bring you in on the know of how to help us.
Thank you, Molly. Jen?
Yeah, I guess, you know, there's so much trauma I feel individually in our communities as a society with these overlapping pandemics of, you know, epidemics, systematic racism, gender-based violence, the pandemic. And I know we're exhausted. I'm exhausted. You're exhausted. I feel like there's so many demands on our time and our energy. And there's so many literal fires, some literal and some figurative, right? Fires that are happening. And it can just be so difficult to reassess and kind of, you know, we're experiencing trauma right now, collective trauma. And I would just say, you know, to ask, you know, talk to our agencies, talk to your legislators, come and talk to us, but take care of yourself too, you know. And I think that when we can't carry the torch, we have to pass it on to someone else. And the best we can do is just communicate, hey, these people need help, or, you know, and figure out whoever that is in your world, whether it's your local rape crisis center or it's Rosa at ODBN, or figure out a way that you can contribute. But I also just want to recognize how disempowering it feels to live right now in this moment with VOCA cuts and everything else going on. So I think that's what we can do, is just recognize it for what it is, you know, the collective trauma that we're experiencing, but then at the same time, telling the people who can pull those levers and make those policy changes that Kristin's talking about, if that's not us in this moment, if that's not you because of this trauma you're experiencing, that's okay. But let's pass it on to somebody who can do that work, you know. And I think that most of us here, my colleagues and the people that we work with and the communities that we represent, there's still people that can carry that torch, you know. And that would just be my primary message is, you know, take care of yourself, but we have to keep fighting. We have no choice. I mean, the literal lives of people hang in the balance.
Thank you so much, Jen. And it is so true. And before I hand it over to Camille with the closing in reference to the time is now and to amplify our voices, Ohio, we also want our constituents, our members, legislators, all of the agencies to understand that we do believe that there is power in the collective. There is power and strength in the collective of our voices, that none of us are here advocating for one region, for one program, for one area. We are all here and will continue to be here to advocate for all survivors of interpersonal, sexual, and gender-based violence within the state of Ohio. And with that, it means all of our agencies that day in, day out are doing this work the best that they can and have been showing up in the midst of a never seen before in our time of a crisis, a pandemic, right? So we've asked of our advocates, volunteers, program managers, all of us, law enforcement, say nurses, attorneys, legal advocates to show up, to be present while they're also navigating what COVID has done in their life as well. So breathe, lead with grace, be in grace, show yourself some grace, which is extremely important. And just know that you're not alone in this fight, that there is power and strength in the collective. And that is why we're having these conversations. Camille, from a legislative and a strategic perspective, what can we do? What should we be doing? And how are we going to tackle also the ask for the rape crisis funding at the governor's line item?
Yes, absolutely. Thank you, Rosa. So I just want to start by reminding everyone that verbiage matters and words matter and how we're framing this. And you all have done a beautiful job of sharing the critical nature of the VOCA grant, of what that actually means. I think sometimes when I'm having conversations with lawmakers or other folks are meeting with lawmakers, if we convey that something is simply a grant that we get to provide a project or a resource, that could be misconstrued as a small project or a small fund. And what I want to communicate to the lawmakers that are watching us today and to all of the programs, the advocates, the members, the survivors that are with us, is the simple basics of what nonprofits are meant to do. That when you look at the longstanding structure of relationships between the federal government and nonprofits, it is a relationship based on the fact that the federal government recognizes that they have voids that they cannot fill themselves, that there are local community experts, content area experts that can provide those services in a more beneficial way to the people who live in that area than a federal government employee can. And to be honest, we're going to do it for a lot less money, for better or worse. And so this is a structure that's been in place as long as this country has been providing social services. We talk about the VOCA grant. That was put in place, as Kristin mentioned, by Ronald Reagan. This money has been distributed to rape crisis and other victim services since the year I was born. This is not a stream that is sometimes used as an add-on. This is literally the lifeblood of how the government is funding this structure that they have identified as essential, as reiterated in the the VOCA Act in the 90s and several reiterations of different federal grants. We have a system in this country, because of our government and how they framed this essential service, that relies on the vote.
Camille, we lost your audio again. Sorry. And as she's going back to that, so understanding those dynamics of how important it is, right? That it is the livelihood, that it is not about cheap labor or those dynamics of understanding that as we're advocating, we have had to go ahead and even though rape crisis centers have received an increase in our statewide budget, unfortunately, we have had to go ahead and offset operational and programmatic cost because of all the VOCA cuts within the last 2 years, right? That it has been impossible for many of us to envision growth, to cover the additional counties, to even have the manpower and the volunteers and the advocates that we need on staff to cover the territories and the areas that we have defined as needing assistance.
Yes, okay. Thank you so much, Rosa. To reiterate too, none of us is planning to be a survivor. This is something that can affect every person in every part of Ohio and the world. And so the idea or the notion that one of our groups could supplement VOCA funding with a different method of raising funds really is rather preposterous. We are not going to charge fees to advocate for folks who are victimized by this public health crisis. We are not going to open up a thrift store to raise money or come up with other fundraising mechanisms that we see so many other low profit businesses or service providers trying to do. What the government has asked us to do is restructure and find funding for crime victims in a system that they created. And so really, we need to increase this state line item, and that is not a full solution. It is going to get us through the next 2 years if we can get that increased so that survivors are not waiting until we have a federal government that recognizes that we must go after the white collar crime fines to have this money. Because what is in a lot of ways really beautiful about VOCA is that it's not taxpayer dollars. We're not raising taxes to do this. That's why it's been so beneficial and so important. So with our state lawmakers, we need this funding. It is crucial. We cannot go back to 20 years ago. We shouldn't be going back to 5 years ago. We need the state rape crisis line item to be increased, not to fill a gap necessarily, but to lay a better foundation for the future long term. And then we also need to have really critical conversations with our federal lawmakers, because this budget talk cycle is going to start again very soon in the spring. And when we're having those conversations, we need to be very direct and explicit about the effect that this has had, the jobs that have been lost, and the people who are continuing to suffer because they don't have appropriate advocacy. I can't say anything better than the examples that the directors have given today, but there is no substitute for direct, scientifically based advocacy and communicating what that looks like and what that means and the nature of sexual violence.
Thank you, Camille. And that last part was that call to action, once again, is that we need to amplify the voices, and we need our lawmakers to understand that it's not one pot fits all, and then you guys go ahead and fight and divide and conquer, that there are needs within our state, right? And that they need to be covered and suffice. And we also need at the federal level the understanding of we have to eliminate this match that is coming out of these fundings. We also, it has to be a complete 100% match waiver for all the programs, because we cannot have unrestricted funds going ahead and supporting at a 20%, right? To go ahead and say, yes, we're able to go ahead and do this work, or a partial match at all, when we could be utilizing that money for so many other things. We need to eliminate a lot of the red tape, even with the CARES Act and funding that supposedly has been provided with the state. There is not enough PPE that we can purchase with $50,000 or $100,000 in our programs when there is no infrastructure for hotspots, when there is no capacity for broadband, when there is no capacity even for us returning back to our spaces or being able to do the work, when there is not enough manpower or advocates because they are not considered essential workers, because there is no hazardous pay involved, because there's so much red tape and how that funding can be utilized. But then it seems like we're giving you a handout. We're not asking for handout. We're asking for what is right. We're asking for what is needed. We are asking for sustainability, and we are asking for the ability to serve survivors in the state of Ohio with dignity, and to be able to go ahead and give them their power back. So to all of the directors that have joined me today, thank you for your time. Thank you for being with us. Thank you to the audience for being with us for this hour in this critical conversation. And we will continue uplifting, embracing, and just amplifying the needs of survivors within the state of Ohio. So thank you once again, and I hope you have a wonderful rest of your week.